Hello, my name is Catherine Hopkins. Today we'll be talking about heart disease and what are the problem solutions and how we can fix them. Heart disease is a many type of disease you can get. The one I'll be talking right now is cardiovascular disease. That is a major factor in a lot of families and stuff that has this disease, and our family does. My grandpa has passed away from it, and when he had his first stroke, he had a seizure. He has had surgery multiple times. He has passed away, but it doesn't stop us from doing anything. And cardiac disease is a good topic to learn about. Because people are dying and something we can do. It's until it's too late, even if you try. So the problem, because people are not caring about you, and care about you and your loved ones. As soon as you feel in your heart, go see a doctor. Pretty much go see a doctor, pretty much, I'm telling you. Because if you feel something that's not doing anything in your heart and stuff that's hurting, you just go see one so they know if you have any issues and stuff. And next I'm going to be talking about between men and women and what are the differences between their heart issues. Heart disease is how it affects your body and mostly your heart. I'm going to tell you why it's a big problem in this world. People are in your heart by putting stuff in your body that you should not put in your body. Your heart is the most major thing in the human body. It helps you pump your blood into your body. The most common type of heart disease in the United States is a CAD. That is a cardiac disease, which affects the blood flows to the heart. A decrease in your part of heart muscle doesn't get enough blood. More time that passes without the treatment, it restores the blood flow. The greater damage of the heart muscle, I'll be lessening the symptoms of a heart attack. Chest pains and discomfort, feeling weak and lightheaded or fainted. Pain and discomfort, like a jaw, neck, or back. Pain and discomfort, one or both arms and shoulders. Shortness of breath. These are all signs of heart attacks and stuff like that. High blood pressure, corn or smoking key risks factors of heart disease. About half American is 47% have at least one of these three risk factors. Several other medical conditions and lifestyles choices can also put people at a higher risk of heart diseases and issues like diabetes, overweight, obesity, unhealthy diet, physical activity, exercising, that's pretty much physical activity, alcohol use, learning about heart disease and mental health diagnosis are related. A cardiorehabilitation is an important program. Anyone who recovers from a heart attack, heart failures, or some type of heart surgery is a survivor program that's included. Means physical activity. You get education about health living, including health eating, taking medications, and a way to help you quit smoking. We find ways to reduce stress and provide mental health. A team of people who may help through cardiac rehab includes your healthcare team, exercise, meditation, experience physical therapy, consider mental health process. This is which men and women affected this world has heart disease in the United States, and my theme to be able to put it all, if you look at it a lot, in your hands, because people in the world may not have any issues in their heart. It doesn't mean you are men, it's also women. I'll be telling you more about women's issues with heart disease, men's heart problems and stuff like that. Heart disease is a leading cause of death. Men in the United States kills about 300,479 men in 2017. as about 1 in every 4 male death. Heart disease is a leading cause of death in all rotating and ethnic groups in the United States, including African Americans, American Indians, American Natives, Europeans, and whites. For Asian Americans and Pacific Island men, the heart disease is a second only to cancer too. About 1 in 13, 7.7% white men, and 1 in 14, 7.1 black men have a coronary heart disease. 1 in 17, 5.8% European men coronary disease has heart disease. Half of the men who died suddenly from coronary heart disease had no Parkinson's symptoms. Even if you have no symptoms, you may still have a risk at your heart disease. Women, heart disease leading caused the death of women in the United States, killing 299,578 women in 2017, or about 1 in every 5 females' death. Heart disease is the leading cause of death of African Americans, white women in the United States, among American Indians, Alaska Native women. Heart disease and cancer cause roughly the same number of deaths each year. For Hispanic and Asian or Pacific Island women, heart disease is a second only cancer as a cause of death. About 1 in 16 women age 20 and older, 6.2 have a coronary heart disease, the most common type of heart disease. About 1 in 116 white women, 6.1%, black women, 6.5%, and Hispanic women, 6%. About 1 in 130 Asian women, 3.2%. There are some reasons you could stop to do so you don't have to end up with heart disease. That is, you can stop these things by protecting your heart. Those are choosing eating healthy foods, stop smoking, physical activity, keep your weight gain, up standards like your doctor's chooses it. These are all examples of heart issues. That is all I have to say today about heart disease for my presentation. I hope you have a good day and have a good night.